Hello everyone, I'm Pastor Philip Johnson. I head up the patient coordinator department here at Sponaugle Wellness in Palm Harbor, Florida. We're down here in sunny Florida where Dr. Rick Sponaugle treats patients from all over the United States and Canada, around the world, and we have a wonderful story we want to share with you today. We're glad you're watching this, and we've talked about the possibility of the hope that you can have while watching this, and as this story is told, and it's her story, it may be your story as well, and you'll be able to see that in the features of what we're going to talk about here today. So let's get started right away. Why don't you tell us your first name?
I'm Janice.
Janice, where are you from?
I'm from San Antonio, Texas. San
Antonio, Texas. Is that where you've always been?
No, I grew up in Wichita Falls, or a small town, Iowa Park, Texas, and lived there most of my life, and moved to San Antonio probably 16 years ago.
So you proud to be Texan?
Oh yeah.
I bet you are. That's awesome. You've got a wonderful story to tell, and I'm holding in my hand some of the the medical aspects of what we discovered here and part of your treatment. But before we get into that, I want you to tell us a little bit about your history. What brought you to Sponaugle Wellness? How was what you were dealing with affecting your life?
Okay. It was about 10 plus years ago, I started having just strange symptoms. Didn't really know at the time that they were all connected, but as I've looked back, I can see that they were definitely connected. I had a burning sensation in my calf, is where it kind of started.
Okay.
Then I had TMJ. I'd have headaches. Mark them off as allergies, or TMJ was TMJ, and then I started having my left knee just started swelling.
Okay.
And it, to where it had enough fluid in it, it developed a Baker's cyst. Went to see a doctor, ran some tests. They were pretty sure I either had lupus or rheumatoid arthritis.
Well, that had to be a setback to you.
It was, because I'd been healthy all my life and had not ever had any health issues to speak of, so it was a little bit of a shocker. Went to see a rheumatologist, and when I was telling him my symptoms, by then I was having joint pain that was floating around.
Okay.
It would visit this joint for about 48 hours, intense, would float around to another joint. And so his comment was, well, this isn't typically rheumatoid, but it doesn't mean it can't progress to rheumatoid. So sure enough, in 3 months' time, it had progressed to what he thought was a classic rheumatoid arthritis case.
Continual stiffness, pain?
Stiffness, pain. It moved on to a joint in my toe. The drugs he was giving me didn't seem to be helping.
Okay.
So they upped drugs. My liver didn't handle that very well, so then they wanted me to go on the injectable immune suppressant drugs.
Okay.
Which I just never felt right about.
Yeah.
So I looked into some herbs and supplements, did that for, goodness, most of those 10 years.
Okay.
And that kept things in check for a while.
That'd be the saving grace through all of this.
Right. It was. It probably saved, it probably saved my life. And I was doing some detox things as well. And then things just progressed to where I had to go see another, like an alternative doctor.
Okay.
He was holistic, but a medical doctor. And so he gave me antibiotic IVs and some antibiotics orally too. Okay. But he was treating the rheumatoid.
Mm-hmm.
While I was there, we did a Zyto test, and that's where 3 of the Lyme bacteria and co-infections showed up. Never thought about Lyme, never had entered my thinking as far as that goes, and I think he just thought it was a secondary issue.
Okay.
So he gave me some drops as well, but after about 3 years of doing that, I was not making much progress. I could be well for maybe 3 months, and then I would crash again, to where I could not get out of bed very easily. I couldn't walk. I'd have to have help getting out of a chair.
Okay.
Could maybe run one errand on a good day.
Life. I
was living at 50%. Maybe even less. Barely functioning, probably is the way I would say.
So with the treatment, you're still declining.
Mm-hmm.
And at that point they've only diagnosed with the rheumatoid arthritis. The lupus, did they leave it on the table? They take it
No,
off?
they took that off because I
Mhm.
guess one of the antibody tests didn't come back with that.
Yeah.
But I did have the rheumatoid factor, so that's kind of where they were leaning.
The walking issues, was that pain, balance, fatigue, a combination of all of it, stiffness?
Well, when your knees are in pain, when every step is painful, it kind of zaps your energy too.
Yeah.
So, I think I probably had chronic fatigue issues.
So
And I don't know if it was combined with the pain or, but.
had you started needing to use a cane or anything at that point? You just
My pride, I never did that.
I knew it.
I never did that. There were
where-
days that I could have,
Yeah.
and days that I probably should have.
Yeah.
But I think for my family and for my kids,
Yeah.
I wanted to be strong.
It's a tough thing to submit to that idea, but already though you would have had to get up every day and think, how much can I do today? How many steps can I take?
Right.
Type thing, and that's what happens to all of us that suffer with this type of sickness. It eventually starts controlling. It makes us hostage to planning our days or
Right,
living
right.
our life, and at first it's, well, can I go to 2 stores, and then it's down to, can I walk across the living room?
Right, right.
Type scenario.
Exactly.
And folks that are watching this, and maybe some of these symptoms have been what you've gone through, and I appreciate you being honest and sharing all this with you and bringing us up to this point. So 10 years of history, getting worse, the concerns associated with that, treatments, and probably some frustration of there's got to be something more.
Right.
There's got to be something else causing this or other treatment. You hate when you feel yourself slipping away and it doesn't seem like anybody knows what to do for you.
Exactly. And when I was with that last doctor in January, blood work looked really bad. And so I just knew I needed to look into the Lyme. That's something I haven't looked into. So that's when I started, researching, and I found Dr. Sponaugle's website.
Okay.
Started watching Testimonials.
All right. Like
and was
these
like,
that we're making
yes,
right now.
Yes. So I was like, okay, I do have a lot of those symptoms, and maybe those headaches, and maybe that burning pain, and
Yeah.
maybe all that was Lyme at the very beginning. And if that's the case, if I get rid of that, then maybe I'll be better. So that's...
Well, let's pick it up here where, and again, for those of you that are watching, I'm not part of the medical staff here. I'm a patient coordinator. I can help you navigate questions and tell you about timeline and insurance and cost. So I had your plan of care nurse, because this is individualized treatment. Not only is your IV therapy made fresh here every day based upon what your testing revealed, Dr. Sponaugle's console, your plan of care nurse involvement, but that plan of care nurse, I like to say, almost becomes your best friend while you're here.
She does.
Really looking out for you and taking care of you. And so I took some notes from her before getting into this video. I just want to remind you folks, I'm not the medical staff, so I'm repeating some of that. I don't want to play doctor here. So I have a couple things I just thought were just wonderful to share. So coming in here, let's pick it up here. Coming in here, you knew you had rheumatoid arthritis. You suspected that you had Lyme disease. It could be contributing to the declining health that you were going through. So 10 years, all the issues leading up to this. One of the things that, or one of the tests that we will do gives us indication or evidence of whether there's biofilm. And for those of you that are watching, you probably research and understand that parasites are able to produce, the biofilm, and yours had ample evidence that you had a lot of biofilm in there. You had this Texas bugs.
I win the prize on that one.
You won the prize. And that just, through the course of treatment, and I don't know if we've said this for you that are watching, but you actually have treated with us for 5 months. And by the way, you look great. I said that to you earlier today.
Thank you.
You look, man, you're ready to get after the world here. So wonderful. And you've paid a toll getting, 10 years. Boy, that can age you and just change so much about you. But looking at you today, no one would ever know that. So you can go out and try to be Miss Texas or Miss San Antonio.
I'm just looking forward to being mom and wife and
mom, wife,
getting back into life.
just enjoying things again, and that's wonderful. So we're going to talk about the biofilm. There was significant biofilm, and that just changed. Through the course of treatment. You just kept producing, you know, there was evidence of the biofilm and evidence of parasites, and we just had to keep working on that throughout that whole process of time. And the importance of that biofilm, or how it causes symptoms, will show up here in just a little bit. I just wanted to make a point that that was just, you know, often dramatic changes in that as you went through the treatment. And with the healing IV therapy that we use, we're able to detox that out, bust open that biofilm, and deal with all those issues as we go along. But here's some very significant things about you. What we would test would be your RDW, which has to do with those red blood cells, actually the size of those red blood cells. And you came to us with elevated size, and in fact significant. And the reason of alarm for that, when you think about your red blood cells are actually enlarging, and which is usually the root cause for that is usually Babesia, one of the co-infections that folks often get. And so as those blood cells get larger and larger, you know, they're being have more difficult passing through capillaries. There's a struggle there continuing the blood flow, and the result of that typically is that you start developing fatigue. One of the primary things that can happen is what we call air hunger or shortness of breath. You don't have to be exercising or doing anything. And so you had that. Now, we talked about this, that you should have probably had much more extreme symptoms from that, but tell us a little bit that might have been indicative of that RDW being so high.
Yes, I would get a chest tightness feeling, and then just having to take extra breaths. I did notice that, and then when the numbers were so high, you know, that was definitely a symptom I could feel. And like I told my plan of care nurse, I just wasn't doing that much during that time. So
You weren't
I was keeping
working out, huh?
No, I was not working out. I was not doing any of that. So I was keeping that to as minimal as possible, because I did feel it, you know. But I didn't feel it every day.
Yeah, you did it fairly well. You know, the symptoms of that, you handled that, you know, very, very well. When you're starving for air, it's a frightening experience, you know, when you're dealing with that. And this can often be the case because of these parasites, that these red blood cells are being enlarged like that, and your blood oxygen level actually lowers through that process. And of course we need that blood oxygen for all the functions, especially the brain function, to be going on and so on. You had some elevated mold, and that you came in with a little bit of ochratoxin, which is, let me clarify that, we say mold, but it's the mycotoxin that are coming from mold. And for those of you that are watching, there are 50, 60 types of mold, structural growing mold, and some of them are very, very toxin, and those colonies of mold that could be growing in your house or behind your wall, that hidden mold that we would call, they're outgassing, they're producing a gas. And the ochratoxin that you tested with typically would come from something like aflatoxin or penicillin type molds that could be growing in your house, and they produce the gas. You ingest it, usually breathe it in, and it can be it's quite harmful, you know, to the body. So you came in with some. As we busted the biofilm, more of it rolled out, and we're going to talk about some other stuff that came out of that biofilm as well. But the detoxification treatment that we have can grab a hold of those mycotoxins and pull them, you know, back out of the body very quickly.
Yeah, the mold was a surprise to me. I didn't know about that, so that was great to get that out of my system.
I'm glad you brought that up, because I take lots of calls, and my team does as well. And just like me, growing up, often was in moldy structures, had no idea that I was breathing in a poisonous gas. I have some of the bad genetics, so I don't detox as well as I'd like. So when we talk to folks and they think, well, I have Lyme disease, but often it's always, when someone comes here, it's never one thing. You could be Lyme and the co-infections, but often these toxins, such as mold or benzene or toluene, which you did a good job with, we'll talk about, are part of the whole component of compromising our health and causing these particular issues. So let's talk about the toluene. Toluene is a cousin to benzene, probably best understood as a byproduct of petroleum. So it can come from gas, diesels, oils, chemicals, and you came in with some, and you just, every week we just kept getting more out of you. Those numbers fluctuated from, and to be positive, what they consider a positive number when it is affecting your body in a negative way is as low as 0.5, I believe. So very insignificant amount of that. And so you would often have 2 or 3. At one time, I think you went as high as 10, which is a significant amount of toluene. And again, this could come from fume events, being around petroleum fumes, gasoline fumes, oil wells. You can get it from chemicals, if you're around a lot of chemicals. Folks that work in the nail and hair techs, those that are constantly exposed to nail polish and hair treatment products can absorb a lot of that. And so at some point in your life, have you ever thought back and tried to make the connection of any of that?
I've thought through that, and I don't know if it was Texas soil. I wasn't, there were oil wells around where I grew up, but I'm not really sure. I like to paint, and I like to do a lot of things like that. So I've been around chemicals.
All right.
I've inhaled. I wasn't as protective as I probably should have been around some of those things. So that's a possibility as well. But and my dad was a mechanic, and I'd visit his shop a lot. I don't know if there were a lot of fumes there. I'm not really sure. Who knows, right?
And back in the day, drove diesel trucks and worked on diesels, and we washed our hands in gasoline at times to get the grease off.
Right.
Not realizing what we were doing to ourselves. But the oil wells in Texas, you can ingest that through your skin even by taking a shower if it happens to be in the water. And I personally feel like some of these plastic bottles that are a petroleum product, there's all these warnings about don't leave your bottled water in the sun because it'll start leaching into the water you're drinking. And I think that the potential of getting benzene or toluene is possible. That's just a theory. I'm just
Who knows where it's all coming from.
All I know is when you get it in your body, it starts causing damage to us. And so in your case, our weekly tests and so on, we kept detoxing it out, and you just kept producing more. We just kept pulling more, and we push it out of the fatty tissue, we push it out of the nerve endings and the brain, the myelin, these type of things that are almost like an attractant to these fatty toxins when they enter the body. So earlier we said something about clotting factors, and we were talking about biofilm, where I was going to make that connection. What was interesting about you is that you came in with high clotting factors. Blood clots are very, very dangerous. And genetically, you aren't prone to form clots. We do some testing on everyone, and anyone that's going to do IV therapy anywhere should check these things out before you would do any IV therapy. And your clotting factors were quite high, even though genetically you're not, your body's not typically going to do that. And so your clotting factors were basically coming more from these toxins that were free floating and wrapped up in biofilm and those type of things. And we were able to successfully detox you and bring those clotting factors down through all of this and do it very safely. We monitor, that's one of the things we monitor on a weekly basis, clotting factors.
Oh, we were watching those numbers every week.
Yeah.
Watching them come down.
It's like the stocks, you're waiting on the stock market to come in and say, what's my numbers, what's my numbers?
What was it this week?
Yeah, it's an important thing to keep an eye on.
Exciting.
Well, it is exciting to see those changes taking place, not only on the paper, in your labs, but when you start feeling it, in your body, the changes taking place. And here is another interesting thing about you, which was been of great concern, is your kidney function when you came to us was so low. Actually, it was right at the borderline where typically if a doctor would have looked at that, they would have been talking about dialysis. Your ability for your kidney to function or filter is what we would say was just bottoming out on you. And so to give the real numbers on that, the GFR, which is that filtration rate, was at a 59. That would probably be what most doctors look at as, wow, something bad here is, you know, I got a real good feeling something bad's about to happen, you know, type thing.
And I had no idea.
Yeah, and you know, that's one of the things about our testing is that we've treated thousands of patients for toxicity, both bug and environmental toxins. And our testing that we do is, we say proprietary testing. Not that we have our own labs or we're creating our own lab work, but the type of testing that we do is unique to patients that are suffering from these toxicities. Tests that are often overlooked. But our patients, Dr. Sponaugle will say it to you all the time, our patients have taught us what's compromised in the body, what testing we need to do. And so we're not just guessing when a patient comes in here, let's, you know, should we do this, and do this. And so folks often say, well, you know, the testing you're doing, you know, that seems like a lot of tests, but it's just things like this that we discover that you won't get well. You couldn't get well if your kidney wasn't filtering. And so that was something we needed to know right up front to not only protect you, but to begin to increase your health, your liver function, your gut, your thyroid, your adrenal glands, the brain chemistry. All that's so very, very important to the overall. I feel like I'm talking so much in this. I should have you tell all this story.
Oh no, you go ahead.
Anyhow, this is staggering to think about. Is that so? Your liver function was at 59, and we gave you 4 of what we call detoxification drips. Now, folks, you that are watching, these are we build these drips fresh every day. I can readily say to you that 90% of everything we do here is all natural. And so with those detoxification drips, with just, according to your plan of care nurse, with just 4 of those drips, your kidney filtration rate went from a 59 up to 105, nearly doubling its ability. And then you stayed that way. You know, we got that working again, and you've been enjoying a clean, functioning kidney ever since. So, you know, it's no, amazing. It is amazing. It's no light matter. Those are absolute essential organs in the body. They are cleansing organs. Your liver, your kidney, they're cleansing. You know, this is indicative of all the toxins that your body was trying to get rid of, and just clogging the drain up. You know, just overloaded, couldn't continue to function and do all of that. So, but thankfully, we discovered all that, and those detoxification drips are remarkable. How much toxin they can, you know, pull out of the body and get a hold of. So, let's get back to you. 5 months of treatment. And this is your exit week. You're going home. Your family's probably putting a sign up right now in the house saying, welcome home. And what kind of cake we're going to buy. And so it's got to be very exciting. But let's talk about, you told us how you felt for 10 years and it just, you know, constantly getting worse. You've been with us long enough to see improvements. We love that. So let's talk about where you are here today, going home, and what you expect life to be when you get there.
Wow, I can get up out of a chair without thinking about it. I don't have to think about my first step, or if my knees are going to be able to hold me, if I'm going to be able to get from here to there. I can bebop down this hallway pretty good.
All right.
Which is, you know, such a change from when I got here, and you know, it was just unstable walking. So, and my energy level, wow, what a difference. From having to pretty much take a nap every day to, I mean, I haven't napped in quite a while since I've been here. Sometimes the drips will make me sleepy. But,
yeah, they can have that effect.
But for the most part, you know, I've learned my way around Tampa and
all right.
Can last the whole day. And
well, that's awesome.
You know.
So fatigue is much better, or maybe not even there at all.
Yeah.
You know, the walking issue. So apparently you've overcome that. You know, the pain or the weakness associated with what you were going through, the RA issue. You know.
Yeah.
Do you feel like you still are dealing with rheumatoid arthritis? Do you feel like those symptoms have just gone away?
I mean, there's probably 10 years worth of damage there in those joints that, you know, I will try to keep up and feed my body things that will
Right.
help those joints continue to heal and get better and feel good. But the pain level is nothing like it was,
Yeah.
and nothing like it has been in the past. So I could live with that. It's not, I can't say that I'm totally pain free. There's slight soreness, some days slight stiffness, but it's.
Well, it's a lot better having, a bad day every once in a while.
Right.
And when prior to that you were having lots of bad days and
Right.
maybe a good day thrown in there.
Yeah, and really at week 7 I had a turnaround, and since then I have not had. That's 3 months of not having any hitting a wall or having a bad day.
Have you been
or
denting the walls up and down the hallway and falling into them?
Yeah, no, it's been a steady progression.
I've seen you moving around and walking fine, just really looking like you got your mobility, back for you, and the fatigue issue. When you start having, arthritis pain can be, unless somebody's suffering it, they probably don't know how bad it can be. It's hard to explain, very, very painful. And so to have that gone, and you're not medicating for that any longer?
Nope.
Okay, and that's so important. So you're dealing with pain-free issues without medication.
Right.
So in and of itself, your liver and your kidney are thanking you right now that
exactly.
you're not medicating for this and you don't need to. And that's typically our goal. That's our goal with everyone coming in here, is that with the natural treatment that we give and the supplements, I don't think we can underestimate the value of supplements and how they help us along the line. So, and well, we're coming to a close, and so you look great, you feel great, you're going home, and we're glad you took the time to share it. These folks are glad you took the time to share that with them. It'll mean so much to them down the road.
I hope it helps someone out there.
I'm sure that it will. So thank you so much.
Yes, thank you.